Hi, my name is Lindsay McComas. I'm a Torrey University nurse practitioner student, and today I'll be conducting a head-to-toe assessment on my patient that's currently sitting here. Hi, I'm Lindsay. I'm going to be your nurse practitioner conducting your physical assessment today. Can you tell me your name?
My name is Krista Hamlin.
Perfect. Can you tell me today's date?
June 23rd, 2019.
And where are we at currently right now?
We are at the clinic.
Excellent. Okay, if it's okay with you, I'd like to sanitize my hands for both your comfort and mine.
Yes.
Excellent. Thank you for that.
Thank you.
Okay, so during this assessment, there is going to be various positions I'm going to be placing you in. Some will be sitting, some will be standing, some will be lying on the table. In addition to that, I'll be touching you in various positions, but I'll let you know prior. If at any point you feel uncomfortable, please let me know.
Okay.
If you experience any pain, let me know as well.
I will.
Okay, so what I'd like to do is start by looking at your head and feeling your skull, making sure that everything is symmetrical in that portion.
Okay.
So at this point, I'll palpate the skull. Make sure that the ears align with the orbits, which they do. Face is symmetrical, hair is clean, dry, no nevi, no lesions, no rashes. From here, I'd like to go ahead and palpate just the various facial bones.
Okay.
Any pain or tenderness here?
No.
Any pain or tenderness here?
No.
Any pain or tenderness here?
No.
Okay, at this point, what I'd like to do is check your eyes.
Okay.
So I'm going to do a various couple of different tests. So let me go ahead and grab my ophthalmoscope. So at this point, what I'd like to do is I'm just going to go ahead and look and make sure that your eyes react to the light appropriately. And they do. So correlate is intact. Pupils are equal, round, reactive to light. In addition, I'm going to go ahead and look a little bit deeper into your eyes. Might be a little uncomfortable. I apologize for this. And the optic disc is yellow and creamy and present. No nicks, no cotton balling. And same on the left eye. No nicks, no cotton balling. Optic disc is present and yellow and creamy. So what I want to do now is I'm going to go ahead and I'm going to look at your nose and then I'm going to look at your mouth as well, since we're already here. So I'm just going to, well, first we'll start with looking at your ears.
Okay.
So the external auditory canal is pink, dry, no lesions. The internal auditory canal is free of any sort of lesions and pearly gray tympanic membrane. And same on the left. No lesions, pink, dry, pearly gray tympanic membrane. So from here, I'm going to have you go ahead and open your mouth for me. Say ah.
Ah.
And tonsils are ones. No lesions, pink, moist mucosa. And I'm going to go ahead and look at your nose. Turbinates are pink and moist. No lesions noted. So from here, if it's okay with you, I'm just going to go ahead and touch a couple of different places on your neck and on the top of your chest.
Okay.
So I'm going to touch the occipital lymph nodes here, the premandibular, preauricle, postauricle, mandibular, submandibular, and under your chin here. And then if it's okay, I'm just going to touch above your clavicles. It's preclavicular, and then postclavicular. And then just to be sure, I'm just going to do some axillary feeling. Perfect. So no masses or tenderness noted. Perfect. Okay, everything seems to be in line. So I'm just going to do your cervical there. Do me a favor, and I'm going to stand behind you, but what I want you to do is go ahead and swallow for me. Perfect. Okay, no pain with swallowing?
No.
No issues there. Okay, great. So eyes, ears, nose, and throat are intact. Skull is symmetrical. Ears show no lesions, throat shows no lesions. Eyes are intact, no optic disc issues. So we're going to go ahead and move on to cardiac at this point. So what I would like to do is I'm going to go ahead and I'm going to listen to several places on your chest.
Okay.
And I'm going to have you repeat some numbers and do some various exercises with me, okay?
Okay.
Perfect. Okay, so first I'm just going to listen.
Okay.
So I'm going to start by listening to the second intercostal space. And I'll do so with both the bell and the diaphragm. And I'll move to the third intercostal. And then I'm going to go to the fourth intercostal, sorry, a little invasive, bell and diaphragm. And then the fifth intercostal space, mid-axillary, both bell and diaphragm. So we've assessed all points, 5 points of cardiac. And then at this point, I'm going to go ahead and palpate for PMI. So I'm going to palpate PMI is present upon palpation. So what I'd like to do now is I'm going to go ahead and move to your back and assess your breathing.
Okay.
So I'm going to listen to several different places on your lungs, okay?
Okay.
So what I'm going to do in this process, after I have you breathe for me and I listen, then I'm going to have you repeat a couple of different things for me as I touch you, okay?
Okay.
Okay. Deep breath in. Deep breath in. Deep breath. Deep breath. Deep breath. Deep breath. Okay, so I've listened to 8 different locations on the posterior aspect of your respiratory system. Now what I want to do is I'm just going to go ahead and feel and make sure that you don't have any additional crepitus or anything like that. While I'm here, I'm going to go ahead and palpate your kidneys and make sure that you don't have any tenderness. Does that hurt?
No.
Does that hurt?
No.
Okay, perfect. Do me a favor and repeat a couple of things for me. Can you go ahead and say 99?
99. 99. 99. 99.
Perfect. I'm going to have you repeat it while I use my stethoscope now, okay?
Okay.
Say it again.
99. 99. 99. 99. 99. 99. 99. 99.
Perfect. Okay, well, thank you for that. So while we're working on the upper portion of your body, I'm going to go ahead and do an additional test that focuses on your cranial nerves.
Okay.
So what I'd like to do is use what's called a tuning fork. So it's going to be the Ryan and the Weber test. So what I'm going to do is I'm going to make this vibrate, and I'm going to place it on your sagittal suture, and I want you to tell me if you hear it in one ear or both ears.
Okay.
Okay?
Both.
Perfect. Okay, so now what I'm going to do is I'm going to place it on your mastoid bone and then hold it next to your ear. And what I want you to do is tell me when you stop feeling the vibration, and when I put it here, when you stop hearing the sound.
Okay.
Okay, I'm going to do it on both ears.
Now. Now.
Perfect. Okay, other side. Excellent. Okay, so auditory is intact. And while we're doing this, let's go ahead and work on your visual fields and see what we have in terms of how your vision is doing.
Okay.
So what I would like for you to do is go ahead and, with both eyes open, hold this at arm's length.
Okay.
And tell me the smallest line you can read.
Wait, what, the numbers or the letter ones?
Let's do the numbers.
Numbers 428,365.
Okay, perfect. So now go ahead and cover your left eye.
Okay.
Read to me the smallest line you can read.
37425. I don't know, 8.
Okay. You can go ahead and cover your right eye.
428365.
Okay, perfect. Thank you so much.
I need my eyes checked.
The patient is 20/50 bilaterally in both eyes. So at this point, I'm going to go ahead and assess your visual field and different eye movements. So what I'd like to do is I'm going to have you look right here at my nose. And I'm going to bring my finger towards you. Follow my finger. Perfect. And now I'm going to assess your different visual fields, okay?
Okay.
Okay, so follow my finger again, don't move your head. So we're going to go here. All 6 visual fields are intact. Okay, so what I'm going to do now is I'm going to check your peripheral vision.
Okay.
So in 4 different areas, I'm going to move my fingers and I want you to tell me how many I have out.
Okay.
Okay, so tell me when you can see my fingers.
Now, 2.
Perfect.
2. 2. 2.
Lovely. Excellent. Okay. Just for fun and annoyances, I'm going to check your gag reflex.
Okay.
Okay, so what I want you to do is, first of all, close your eyes real tight. Perfect. Open them up super wide. Perfect. Scratch your forehead. Grit your teeth. Okay. And puff out your cheeks. Lovely. And then go ahead and open your mouth, stick your tongue up and down for me.
I don't know how to do that. I can't follow directions.
That's like my kid. Totally fine. Now I'm going to check your gag reflex. So I'm going to have you open your mouth and say
Okay.
off for me.
I don't really have.
Gag reflex is present. Okay. So I'm going to just continue to check various cranial nerves at this point. So what I want you to do is close your eyes for me and tell me when you feel the sensation and where.
Forehead. Left cheek. Right cheek. Chin.
Perfect. Excellent. Everything's intact. Okay. So, in continuing to move on, I'm going to grab my various tools here.
Okay.
Let's see. So, phonation's intact. You speak very clearly. You're very eloquent with your words, which I appreciate. I thank you for that.
Thank you.
Okay. So, what I'm going to have you do now, in being that it's a full body head to toe assessment. So, I've listened to your lungs. I listened to your heart, but now I want to check your abdomen.
Okay.
So what I'd like for you to do is go ahead and lay on your back for me.
Okay.
And this is going to be a twofold situation because since you're already laying down, I'll be able to listen to not only your aorta, your iliacs, your renal arteries, and your femoral arteries, but I'll be able to palpate them as well.
Okay.
And in addition, since you're already laying flat, I'll have you lay on your left side and I'll be able to palpate and listen to your point of maximum impulse.
Okay.
Okay. So in listening to the abdomen, I'm going to listen to all 4 quadrants. Each quadrant will be listened to for approximately 60 seconds. But for the sake of this video, we will cut that down. and bowel sounds are normal active. So at this point, I'm going to go ahead and percuss. So I'm just going to look at your liver and your spleen. I'm going to have you do a variation of exercises while you're lying in this position, okay?
Okay.
So the liver is dull and it is measuring at approximately 6 to 7 centimeters. Upon palpation, there are no masses noted. The abdomen is soft, non-tender. The umbilicus is midline with the sternum. So at this point, what I'm going to do is check for any sort of appendicitis issues. So what I'm going to do is check McBurney's point. Take a deep breath in for me. And deep breath out. Any pain with that?
No.
Okay, perfect. What I'm going to have you do is lift your left leg up. Any pain there?
No.
Okay, excellent. So I'm going to have you flex your leg and rotate it over. Any pain with that?
No.
Okay, so what I'm going to do is I'm going to come over to this side, and I'm just going to press on your left side. Any pain on your right side?
No.
Perfect. Okay. So I'm going to go ahead and have you turn over on your left side. And I'm just going to go ahead and listen again. So second intercostal space bilaterally, third intercostal space, fourth intercostal space, fifth intercostal, axillary line. Okay, perfect. Everything sounds great. You can go ahead and sit up for me. So from here, I'll have you scoot down. We're going to do a couple of different other things. We're going to test your strength and see kind of how you're at and make sure that everything's good, okay? Okay. So from here, what I'd like you to do is go ahead and place your palms face up. Perfect. I'm going to push down on them. Don't let me do it. Okay. Great. Strength is good. 5 out of 5. So I'm going to push up. Strength is good. 5 out of 5. Go ahead and go like this for me. I'm going to pull. Don't let me do it.
Okay.
5 out of 5. Other way. 5 out of 5. Great strength. So from here, what I'm going to do is I'm going to push on your legs. Don't let me do it. Okay. 5 out of 5. I'm going to pull. Push back. Perfect. So on your feet, go ahead and push up. And push up towards the ceiling. Perfect. So strength is 5 out of 5 all the way around. So what I would like to do now is do some deep tendon reflex and just check and see how everything's going. During this time, I'm going to perform deep tendons on radial, brachial, patellar, and also on the ankles. The Achilles, yes. So at this point, what I'm going to do is I'm just going to go ahead and tap here for it. Elicit that reflex.
I'm like jumping.
Terrible patient.
I am.
Okay, all reflexes are intact there. So we're going to go with the patellar now. Intact. Intact as well. And then we go for the Achilles. Okay. All right, intact. And then we check for the Babinski. All right, perfect. Okay, everything's intact. At this point, do me a favor. So one of the last things I'd like for you to do is go ahead and just because we're assessing strength and dexterity at this point, I want you to go ahead and shrug against me. Perfect. 5 out of 5. Go ahead and, you know what, I would like to check your range of motion. So I feel like go ahead and lift your head up, chin up. Perfect, no pain with that?
No.
Chin to the floor. Perfect. To the right, to the left. Okay, range of motion is intact and no JVD is noted at this time during range of motion. Okay. Let's see. Okay, so to complete this exam, I'm going to go ahead and have you do some range of motion exercises for me, okay? If you can, go ahead and put your arms out to the side. Perfect. Over your head, behind your back, and to the front. Excellent. And so with your legs, what I want to do is go ahead and have you take your left leg and slide it down your right shin. Perfect. Can you do the same on the other leg? Excellent. Can you have your feet point up to the sky?
Right.
Perfect. And down towards the floor. And if you go ahead and stand for me, are you able to walk heel to toe in a straight line for 5 steps? Perfect. Excellent. Thank you so much. You can go ahead and have a seat again. At this point, I feel like you are incredibly healthy. And I really appreciate you coming into the clinic.
Thank you.
Thank you so much. Have a great day.
You too. How long was that? You did.